the Prime Minister's condition worsened, and on the advice of the medical team, he was moved in to a critical care unit.
The UK's virus crisis takes a dramatic turn as Prime Minister Boris Johnson fights to recover from COVID-19.
This is going to be the hardest and the saddest week of most Americans' lives.
In the U.S., the Surgeon General warns of potential shortages of much-needed hospital beds as New York's coronavirus deaths skyrocket. And in Tokyo, a debate between stricter lockdown measures and protecting personal rights. Hi, I'm Jennifer Zabasaja in New York.
And I'm Kurumi in Tokyo. Here's what you need to know about the pandemic this week on Quick Take. Meet the New York kitchen staff feeding the healthcare workers on the front lines. We'll introduce you to a teenager behind one of the top websites tracking COVID-19. And we'll take you to Yemen, one of the few countries that have yet to report a single case of coronavirus.
So much of the world still remains in lockdown, but countries like China, Denmark, and Austria are slowly trying to work their way back to normalcy without risking a second wave of infections.
I fully expect, though I'm humble enough to know that I can't accurately predict, that by the time we get to the fall, that we will have this under control enough that it certainly will not be the way it is now.
Now, this easing of restrictions made us think about ways in which we could help avoid contagion, aside from social distancing. One of those ways being tested actually has to do with immunity. Okay, Drew, so let's start off with Boris Johnson. He's the first world leader that we know to have fallen seriously ill from this virus, but there were conflicting reports about what his condition was in the intensive care unit and whether he needed a ventilator or not. Do you know why a COVID patient would need to be in the ICU if they didn't need a ventilator?
But just because someone is in the ICU, it doesn't necessarily mean that they are on a ventilator. It just means that they need more intense care. A ventilator or a heart-lung bypass machine, that's kind of the most drastic step that you can take. But before that happens, there are all sorts of other ways of doing that, with just like pushing some oxygen in through a mask or something like that can help those patients get more oxygen into their bloodstreams and give them the type of support that they need to hopefully get better.
Let's switch topics slightly because your team has some reporting on a new immunity test that's being experimented with here in the U.S. that might actually help workers eventually get back to work, things back to normal without risking a peak of infections. And Governor Cuomo actually talked about it this week. What can you tell us?
But you need to be able to figure out who had the virus previously and who might have some immunity. And the way you look for that is what are called antibodies that are circulating in the blood. Those are essentially molecules that are produced by the immune system, and they're essentially the immune system's memory. And we can go and look for those. And so to do that, you take a blood sample from a patient and you look for those antibodies. And you say, okay, it looks like you were at some point or another exposed to this virus. Maybe that thing that you had that you thought was the flu was in fact coronavirus, or the thing that you knew was coronavirus but you couldn't get tested was coronavirus. And while we don't have a vaccine yet, this tells you essentially, hey, who was exposed, who might have immunity, and who might be able to get back to work or be around other people with less presumed risk.
There's been talk about blood transfusion also potentially helping, cut back on the spread of the disease. Do you know much about this? And if so, what can you tell us?
So the theory behind this, what's called, convalescent plasma therapy, is that you essentially take blood and blood plasma from a person who was sick at some point, harness all of those antibodies that are in it, and then reinfuse that blood plasma, that antibody-rich blood plasma, back into a patient who's suffering, basically saying, hey, we're going to basically provide a booster shot to your immune system from somebody who has already faced this thing and beaten it, and let that person's immune system do some work for you. But it's something that has been tried in Ebola and in other infectious diseases, and it's exactly the same theory that we're talking about here. Use a person who's recovered from this and the power that their immune system has to go and treat someone who's still fighting it. It's really, really interesting, and it's fascinating medicine.
A New York City restaurateur and his family are working overtime to feed healthcare workers working on the front lines of the coronavirus pandemic. We got to spend a day with him to see how it all comes together, one meal at a time.
Just dropping out the food.
Thank you so much.
Wait, so what I'm gonna do is get the red.
I had to make the tough decision of letting go over 90 people.
Whew. Today we're doing about 1,000. Listen, I'm doing a delivery right now. All right, stay safe, guys, please. This is the most important thing.
They all have a smile on their face. They tell me they don't have time to eat. It takes them 20 minutes to get out of their protective gear, 20 minutes that they don't have. This makes them realize that people from the outside are thinking about them.
We're on the Upper East Side in Central Park, and this is Samaritan's Purse. They're setting up impromptu hospital beds and ER systems. Awesome.
Thank you guys so much.
One of my good friends helped me set up the website in 18 hours. So I'm the person on the other end of the phone when you call.
So Ian is helping with all the math, even though he's a history buff.
I've really had to step away, step out of my normal life and focus on other people.
Her name is Adair Roberts, and Adair said, oh my God, I just read the news about New York and all the restaurants and bars that are having to close. How's Luca doing? I'd really like to support him in his business. And I'm thinking I'd like to buy a bunch of meals. I want those meals delivered to healthcare workers that are working on the front lines.
So among the people that we were able to bring back is my head bartender, who is now my head delivery guy.
We appreciate all New York coming together. I've been saying lately that, they say that New Yorkers are mean, and this is proving, that we're not.
Find a purpose during these crazy times. We all can help.
Welcome to Tokyo. We've been seeing a jump in the number of coronavirus cases here, so Prime Minister Shinzo Abe declared a state of emergency. The order covers 7 prefectures, including Tokyo, requesting residents to stay home unless they need to go out for essential tasks.
不安だろうなっていう気持ちありますね。みんな休めなくて来てる人ばかりだと思うので。
The worry here, though, is that many residents are saying, is it too little, too late?
強制力がないんだったらもっと早く飲み込んで、全体的に宣言を出しておいた方が良かった。
The other thing is the Japanese government, even though they impose a state of emergency, it doesn't give them complete power over residents to stay home and self-isolate. Businesses can still stay open and operate. It just gives them a bigger push to close their businesses and keep their workers at home. It also pushes schools to close, again, not forcing them, but encouraging them and urging them strongly to close. Yemen has yet to report any coronavirus cases, but the country's addiction to a narcotic leaf called cat could spell trouble for the spread of COVID-19.
Yemen, the Arab world's poorest country at the southern end of the Arabian Peninsula, has no confirmed cases of COVID-19 so far. But the World Health Organization and international aid groups have warned that any outbreak would be catastrophic. As the health system is on the verge of collapse and also is in no condition to deal with any epidemic. Even before the war, the medical services in Yemen were so basic. An outbreak in the country will be more crisis that Yemen doesn't need, and it is one that will be hard to control. One main challenge will be the country's addiction to khat, a mildly narcotic plant that looks like mint and is legal in Yemen. Yemeni men go to crowded markets every day to buy fresh supplies, usually sold in plastic bags. They then join family and friends at home or outside for chewing. These sessions usually last for hours. There is usually a sober-sized shisha in the middle of the room that is shared by everyone. Yemeni officials do not know what to do about these crowded markets, which could, of course, turn into breeding grounds for the virus if there is an outbreak. Some cities and provinces have tried to move the markets outside their premises, but that resulted in dog rows as Yemeni drove to get their fix for the day, and the markets were restored to their original location. Some cat dealers are selling in small shops near their homes. The Houthi rebels issued an order yesterday to move the markets outside the city. But cat dealers and people were still seen buying and selling in their original markets.
I'm Sarah Ponsick, and I am a markets reporter with Bloomberg News. So more data is emerging on what investors actually did with their portfolios when stocks were falling steeply last month in March into a bear market, meaning that they fell more than 20% from a record high. The S&P 500 down 34% at its lows. And as it turns out, actually, millennials reacted more than the rest of the broader clientele. According to TD Ameritrade, they have a measure called the Investor Movement Index. It tracks client positioning, how exposed clients are to the markets. And for the first time ever, they have a separate measure that just focuses on their millennial clients. It fell below that broader measure. According to their chief market strategist, most of the selling did occur in the first half of the month. And then in the second half of the month, clients actually turned out to be net buyers. And speaking of buying, we have seen some massive forceful buying days in the stock market in the past couple of weeks. Very strong rallies, 9%, 7%. We've seen it very often. These have been the best days since the likes of 2008, at times even since 1930. But there is a very hot topic right now, and that is whether or not these bounces are just bear market bounces or the start of something real. Many portfolio managers say the truth is that it's virtually impossible to test the market, so you might as well continue what you've been doing, continue to dollar cost average, meaning just on a set schedule, keep adding money to your portfolio. That should smooth out the bumps. But with that said, we do want to know what you're actually doing with your portfolio, so we want to take a poll. A, are you selling? Are you de-risking? B, have you been buying, maybe looking for some sweet deals in the stock market? Or C, are you doing nothing? You're just sitting tight, waiting it all out. So you can leave us a comment below, or you can also take our live poll in the top right-hand corner of your screen. Thanks, guys.
17, he runs one of the biggest COVID-19 tracking websites in the world, as if it's no big deal.
I mean, I'm pretty much a terrible student. Maybe don't tell my parents that. You know, I still want to play video games with my friends and stuff like that. It's fun to just be a normal teenager sometimes as well, and, you know, forget that, you know, I'm running one of the biggest websites in the world. Yeah. Say hello to Bloomberg. Hello, Bloomberg. My name is Avi Schiffman, and I'm 17 years old, and I built one of the largest coronavirus tracking websites in the world. I just wanted to make an easy way to find the numbers and how many people were infected with the coronavirus. And I noticed it was just really hard. I mean, you had to go to Chinese government websites to get the most up-to-date information, but, you know, it was all in Chinese. And so I thought I could just extract the numbers and add it to a much larger data set. And I do that for basically every single country. I wanted people to be able to get the information just at a glance, see the total confirmed, you know, the total deceased. It's just all right in front of you. The traffic has just basically exploded. In total, I have about 350 million visitors, and every single day it's about 30 million now. I think when it really blew up, I just skipped like a week of school and then it got closed like on the last day anyways. I mean, I'm pretty much a terrible student. Maybe don't tell my parents that. Quick facts, you can see the total confirmed.
Like an art project that your kid shows you, most of the time I go, oh yeah, that's nice. But when he came down and showed me that he had created a website that was accumulating facts and numbers in regards to the coronavirus, it was really obvious this was gonna affect pretty much every human being on the planet. And so I was really taken aback. As a physician, you know, patients initially, this was a faraway problem. And so I would bring Avi's website to light and say, look at these numbers, look at how quickly this is gaining territory. And it would help my patients understand the importance of what we're dealing with and what we're gonna face. I remember very clearly a moment where he said to me, I got emails asking me to put ads on my website. In fact, one of them is offering me $8 million. And then he said, but I turned them down.
I think it's a lot easier for me to turn down things like that just because I don't care that much about making so much money. You know, I feel like as an adult, you know, oh yeah, I'll just retire now, but you know, I don't want to retire at 17. I mean, half the stuff I did on this website, I didn't even know before I started. But I think one of the big things about my website is that, not that it's very hard to program, but that, you know, I took the initiative to make this, you know, when nobody was talking about this. I hope that what I created, you know, inspires a lot of young people to find ways they can help. I mean, this is a global pandemic that affects everybody, you know, find out what they're good at and, you know, put their skills to use in something like this.
If you can't get your hands on a face mask, experts are saying just make it yourself. Our Maddie Mills shows us how simple it actually is to do that and how to make sure it's effective.
The CDC is recommending that Americans wear a face covering when out in public, though guidance from the White House has been a bit more unclear.
I don't think they'll be mandatory because some people don't want to do that. You can do it, you don't have to do it. I'm choosing not to do it, but some people may want to do it, and that's okay.
This comes as there's already a shortage of personal protective equipment for our healthcare professionals. So I'm going to show you how I made my own non-medical mask right here at home. You need any 100% cotton fabric, so I'm using a tea towel. You'll also need 2 rubber bands. Start by folding the top and bottom halves so they meet in the middle. Flip it over and repeat. Add your rubber bands to the ends. Fold your ends into the middle, and you've got your own make-at-home mask. Now I'm gonna call up my colleague John Lowerman to ask him to check my work on this mask. First, can you tell me why we're suddenly hearing that we should be wearing masks?
Okay, so what's changing right now is recommendation. Some countries do have requirements for use of masks in the public, but right now there are no requirements in most Western countries, and most countries around the world don't have requirements. They just have recommendations. It just hasn't been studied very well. It's a very difficult issue to study for a variety of reasons. And there aren't huge supplies of them. So the idea is that they should be reserved for the people who know how to use them and really need them, and that's mainly for healthcare professionals.
And is the mask more for protecting others than yourself?
You know, it's a barrier. To some degree, the mask may block droplets coming toward you, but it's much better established that the mask blocks you from expelling those droplets.
So I've got my own mask right here. Would you mind telling me what you think of it?
Could you put it on for me, please? So it's not face fitting, so you can still breathe in. You could potentially breathe in, particles and droplets. They might find their way in, right? There's a certain amount of training that goes into using masks, which is don't touch the outside of it. That's basically what it is. When you're taking on and off, you're not supposed to touch the outside. The mask effectively stops you from touching your face. I mean, your mask looks totally fine to me.
All right, that wraps things up for us this week, but you can still get all your coronavirus news from Quick Take 24/7 on Twitter, Facebook, Instagram, and YouTube.
And for a daily recap of the day's top stories, subscribe to our newsletter. Thanks for watching. We'll see you next week.